Ladies and gentlemen, welcome back to Doc Talk Podcast with the Jabawi brothers. I'm your host, Dr. MJ, and my co-host, Dr. AJ.
How you doing, my man?
Good to see you, bro.
Thank you, man. You look good.
Thank you. I like the white. It's like
It does look good. It's a good reflection, especially off the light.
It's like good and bad, right?
Yeah. Well, this is, you know.
It's kinda
I'm the
makes
sweet,
sense.
nice guy. You're the crazy, you know, got a dark side to you. so.
And for everybody watching, again, go subscribe to our channel. Follow
Yep.
us on YouTube,
Yes,
Facebook, TikTok, and get involved. And again, if you guys think AJ's the good one and I'm the bad one, let us know in the comments. Actually, we'll take a survey. We'll put a survey, and we'll see who thinks you're the good guy and I'm the bad guy.
They all know I'm the good guy.
Yeah, that's true. We'll see.
Everybody
We'll put in the
knows.
survey, and we'll go from
Fine.
there.
I'm
We'll
down.
find out. What's
I'm
our
down.
topic today, my man?
We are actually talking about heart disease today.
Very
I
important
think this
topic.
is such a very important topic. We don't have to go too much into detail with different types of arrhythmias and all that stuff, but I think heart disease, people have to know what the cause of it is typically and how to treat it and how to prevent heart disease. So
I feel like people are like one of the most common things you always hear: heart attack. You know,
Yeah.
like I don't want to have a heart attack,
Yeah,
and like they
yeah.
use it so often, and it's like, well, if you don't want to have a heart attack, then you got to do all the things to prevent the heart attack because it's the best way to go. Now there
Absolutely.
are some genetic factors, but we
Yeah.
can't control that. Let's talk about
Yeah.
what we can control.
Well, it is, especially like congenital issues and stuff like that and genetic factors. But I think the most common one that people, need to know about is, coronary artery disease in
Yeah.
general, atherosclerosis, blockages of the heart,
And
you
things
know,
that cause
or
it, yeah.
muscle issues, the heart muscle issues. So there's so many factors behind this, but let's stick to the basics. I think in our patient population is coronary artery disease, how to prevent it, how to treat it, and what can you do to improve your lifestyle if you have heart disease.
And that's why we always say start young, don't wait. And the reason we emphasize so much on cholesterol is because that's such a big factor in it.
It is.
And
Absolutely.
one of the things I always talk about, patients hate medications, right? Let's talk about the medications that decrease mortality. There's 5 medications that decrease mortality.
Go for it.
Aspirin,
Yep.
statins,
Yep.
ACE inhibitors, beta blockers, and spironolactone.
Yep.
And those are 5 medications that are going to save your life.
Yeah, and there's evidence that they
Exactly.
reduce mortality.
And most people don't like, cholesterol medication. It causes muscle pain. Aspirin causes
Bleeding.
bruising.
Yeah.
But these are the 5 medications that if your doctor says you have heart problems, you should take them. You
Fact.
know?
Absolutely.
And you can fight it all you want until you have a heart attack. And the first thing they're going to ask
Yeah.
you when the EMS shows up is,
If you taking your medication.
have you taken an aspirin?
Yeah,
And
yeah.
there's a reason they ask you for that. Now,
Yeah.
again, I'm not saying everybody needs to be on an aspirin because there's a lot of patients that I get, they're like, why do I need to be on it?
Yeah, I get
have
it.
no
Or if you have
risk
bleeding
factors.
disorders or issues,
Yeah,
and
I don't
you
have
know,
any risk factors and I have a history of bleeding. Why would I be on
for
it?
sure. And I get it. And you know what's funny that you said that is that you mentioned that heart attack, right? The scary part about it is that there's a lot of people who have coronary artery disease or atherosclerotic heart disease and don't know about it until they have the heart attack.
Exactly.
You see what
They
I'm saying?
wait.
Yeah, exactly. They think they're fine, and it's not always chest pain, right?
And it's not always symptomatic.
Absolutely. And women actually can present different than men. Typically they say that men present with that chest pain or it radiates to the jaw, radiates to the
Women are
shoulder.
more common,
abdomen.
right, to
Yeah.
have-
But women in general, actually, they did a study that it shows that they present with more symptoms of like shortness of breath and fatigue,
Because the estrogen?
Yeah, most likely.
Yeah.
But so that's what's scary about it is that it's not your typical, oh, my chest hurts.
Yeah.
Oh, I'm having a heart attack.
It's going to the left side,
Yeah,
going down
exactly.
my arm. It's not always that presents
It could
that
just
way.
be as simple as jaw pain. Your jaw
Yeah.
is hurting, or your belly hurts, and your stomach. You feel like your stomach is hurting. Oh, I ate something.
I mean, GI, okay. So one of the most common issues that emergency doctors have is people who come in chest pain, most of the time is GI related.
Yep.
You
Yep.
know,
Yeah.
and
The
so people
majority
get
of them.
scared. I've had patients, though, that presented to the emergency room multiple times because it was GI until they actually had a heart attack.
Yep.
And so that's why it's really important that, like, hey, talk to your doctor if you have any of these symptoms, or even if you're at risk,
Yep.
get a stress test, get
Exactly.
an echocardiogram. Let's find
Exactly.
these things early.
There's
Let's
so
prevent
many-
it.
Early detection is an important factor, and honestly, I mean, but it also leads. We come back to prevention, right? How can we prevent all of this, right? And the biggest thing is, for me at least, is exercise, right? Exercise to reduce
Why exercise?
smoking.
Explain it to them so they understand.
Because it increases the circulation, and then the
your heart
arteries
needs blood.
Well, of course, because everything works off blood, and
Yeah.
the muscle pumps because it needs all the blood. But I always use the analogy of, imagine your arteries or your heart, your blood vessels, causing, if you have blockage, it's like an accident on a highway, right?
Yeah.
The blood supply will help heal, and if there's so much blockage, it takes a while for the blood to get to that area, the muscle that it needs.
And that
to,
tissue
you know?
dies.
Yep, and that's unfortunately how it happens.
And we talked about this on a few episodes of just how the actual heart attack happens with oxygen gets transported through blood. that blood needs to get to the heart, and if the
Yep.
blood doesn't get to the heart, that means it doesn't get oxygen, which
Yep.
means that tissue dies.
And that's where
That's
the heart
big.
attack. Of course.
Believe it or not, I got a story for you.
Tell me.
I know you don't like my stories.
Your
but I'm gonna tell
stories
you
are
a
great.
story.
Go for it. Not all of them, but I like some of them.
I had a patient. He came in, heavy smoker, cholesterol. He's like, hey, man, just a couple days. I got a little tingle in my chest, man. Don't worry about
I'm
it.
good. Yeah, I'm good. Yeah.
And I'm like, no, I need you to get a stress test. I need to send you it. No, I'm not going to do it. I'm not going to do it. I don't know what it is, but my heart told me, like, call this guy. He left. He refused. He continued to refuse. I called him very upset. I said, listen, I've never asked you for anything. I need you right now to go to the hospital. We need a stress test. We need a cardiac cath. We need something done.
Yeah.
No. I called his wife. Everything I can. He gets to the hospital, does a cardiac cath, ends up rushed to open heart surgery. Cabbage times 4.
That is insane.
Open heart surgery. And literally, if he went 2-3 days, he would have died.
he would've died.
He might have
He
even
would've
died
collapsed.
that same night.
Yeah, 100%.
But because I know my patient, I know what his symptoms are. And again, risk factors. Smoker, high cholesterol,
sedentary
eats
lifestyle,
bad.
obesity. Yep.
That's why you got to start these things early. Don't wait until you're 50 and you're like, I can't prevent it.
100%. No, I agree. So what are the different tests that we could do to figure that out, right? So initially, stress test, right? You could do.
You don't have to do a
echocardiogram.
treadmill. Everyone's like, I can't get on the treadmill. I
There's
can't
certain
run.
medication that
You
they'll
can do
give them
something.
that could help, push the heart a little bit to its limits and see if there's any blockage or not.
100%.
But at the same time, the biggest part is that a family, our family, for example, my father-in-law, may he rest in peace. He kept on complaining of stomach pain.
Yeah.
And I always tell him, listen, go check it out. You have to get checked. He's like, oh, man,
that's just stomach.
I
It's my
ate
stomach."
some spicy. It's just it's my stomach. And he was driving. on
Nausea,
the
right?
highway. He became nauseous and he died. He died before he got to the hospital.
Great guy, too.
Yeah,
man.
he was
Rest
an
in
amazing
peace.
man. So if there's any kind of symptom, even if you get concerned, get it checked out. Talk to your doctor, and especially if you have risk factors. If you're a smoker, if you're
Exactly.
obese, like okay, if you run every single day and you've never had chest pain, you're very athletic and very healthy, and you might have ate some spicy. Yes, maybe it might be acid reflux.
But you can also get hypertrophic cardiomyopathy at a young age.
at a young age,
Soccer
yes,
players
exactly.
run and collapse.
Exactly.
But I've been asked that multiple times. What do I do? That's hard. That's
Yeah.
really hard because you're young. Most people are not going
I
to do
get it.
echoes.
I get it.
But
Yeah.
like if you've had anybody in the family that's happened, sudden death, you should definitely look into
Exactly.
it. And don't wait because there's no waiting. You get it.
Yeah.
You're not going to make it unless,
I did a publication when I was in residency about broken heart syndrome.
Yeah.
Also-
Like broken heart, like you broke up with your girl and I feel broken.
Well, typically the majority of patients is more female, and more females, typically over the age of 60, 65. But basically, it mimics a heart attack. I mean, it's called Takotsubo cardiomyopathy, which is broken heart syndrome.
Yeah.
It literally mimics a heart attack. So if you went in with chest pain to the hospital and they did an EKG in the ER, you will have ST elevations.
So it'll literally
It
look
is
like
an ST elevation. They're thinking it's an MI. They rush into the cath lab. They do a cath and it's completely clean. That's
so then what do you do in that situation?
nothing. At that situation, you typically put them on beta blockers and you just kind of maybe repeat an EKG after a couple months, but there's really nothing to do after that. It's just got to let them heal, But see how scary that is? Even just bad news or a breakup or something causes broken heart syndrome and you can suffer from that. So heart disease is pretty scary. The pump, that's
And know your
everything.
family history. I mean,
It's
if
the
you're not
control
adopted,
center.
also know your family history.
Yeah, of course.
Know if your dad had a heart attack at a young age. Like our cousins, his dad had a heart attack
Oh,
at 40. Then his
absolutely.
son had a heart attack at 40. The
Yep.
one 38.
There's so much
and it's
genetic
scary.
predisposition.
Genetic plays a big factor. Know your family history is very, very important.
100% agree with you, man.
And so like these are the little things that we're pushing for. Like we love to have fun on this podcast.
Yep.
And it's always enjoyable to laugh, but we really want people to get a little bit more serious and get healthy. We're both exercising every day,
Yep.
eating right.
Set goals for yourself.
I mean, a month ago I wasn't,
Yeah,
had a
that's
lot of
fine.
muffins.
But you gotta look at Dad, right? Dad. I mean, Dad had.
He didn't even know.
He didn't know. He was just. We were in the pool. He was just constantly getting tired. He turned pale, and then he had a blockage. We had to get him tested. And he had a
stents now,
blockage. He had
yeah.
stents now. So, but my dad is probably not the healthiest person in the world either, too.
Yeah,
but
he's-
he's trying.
He's trying.
He's trying.
That's
He's
why
trying.
we moved him here so we can get him
Yeah,
healthy.
exactly. We're trying.
And so if you
He's
do
doing
have
well.
a father, mother, brother, anybody that is not healthy and you do have a high risk for heart disease, get checked up.
I
Talk
agree.
to your primary care. Get an EKG.
Yep.
Get a stress test. Get whatever you need done. Now, I'm not telling everybody to go run to the doctor and get a stress test
Yes,
tomorrow. That's
yes.
not going to happen.
That's not how it works.
Okay? But at any symptoms, at any point, get checked, get involved, get healthy.
For sure.
Okay?
For sure.
For all of you guys, don't break my heart and give me a heart attack. Follow us on
Unbreak
YouTube.
my
Subscribe to our
heart.
channel. We love you guys.
Say you love me again. Remember
Wow,
that
that's
song?
pretty good, dude.
Thank you.
I
I'm
can't
trying.
sound.
Oh, that song,
I sound like
"Unbreak
a guy that's
my
been smoking 50 years.
How
Hey,
could you be so heartless?
remember the time when Bobby Boucher?
That's the Water Boy, bro. Great movie. All right, guys.
Love
we
you
love
guys.
you. We'll see you later. Thanks.
good one.
Bye.